Hey guys, welcome back and you are watching Max Medicine Simple MMS. In the previous lecture, we have discussed about the introduction of rheumatology from playlist of rheumatology. Today we will talk about rheumatoid arthritis, the inflammatory arthritis. So here we have one rheumatoid factor, which is an antibody against the antibody, and IgM against the Fc portion of IgG. Also in rheumatoid arthritis, you will have elevated ESR and CRP, inflammatory markers. And here is the picture of rheumatoid patient and her name is Simran. She is my imaginary patient, right? So with this picture, you can imagine that rheumatoid arthritis not only affects your joints, but also patient manifests with the extra articular manifestations like pericarditis, pulmonary fibrosis, ophthalmologic and CNS manifestations, and Baker's cyst. Baker's cyst, which is also known as popliteal cyst. It's a swelling in the popliteal space, the space behind the knee, and it causes stiffness and pain. Sometimes Baker's cyst can cause swelling and redness in your lower leg that can be similar to the symptoms of a blood clot and sometimes suspected as deep vein thrombosis, DVT. So rheumatoid arthritis is a chronic inflammatory disease of unknown etiology, which is marked by a symmetric and peripheral polyarthritis. This is the most common form of chronic inflammatory arthritis, which results in joint damage and physical disability, loss of function. This is also systemic disease, right? This means this can affect any part of your body, okay? So, which results in the variety of extra articular manifestations like fatigue, subcutaneous nodules, lung involvement, pericarditis, peripheral neuropathy, vasculitis, and hematologic abnormalities like anemia. So, rheumatologic disease can be categorized as monoarticular, which affects one joint, oligoarticular, which affects 2 to 4 joints, and polyarticular, which affects 5 or more joints, right? So, here remember that rheumatoid arthritis is polyarticular, where osteoarthritis can be mono and oligoarticular. Though rheumatoid arthritis can start as mono, oligo, and polyarticular, but the advanced disease is always polyarticular. We can also classify rheumatologic disease as inflammatory, non-inflammatory, septic, and hemorrhagic arthritis. So remember here that your rheumatoid arthritis is an inflammatory type of arthritis, along with your Sjogren syndrome, gout, SLE, juvenile rheumatoid arthritis, and lastly seronegative spondyloarthritis. Whereas the osteoarthritis is a non-inflammatory arthritis, along with your osteoporosis, fibromyalgia, trauma, and Charcot joint disease. Let's talk about the joint involvement. So your rheumatoid arthritis involves your wrist and your MCP, metacarpophalangeal joint. Your osteoarthritis involves your DIP, that is your distal interphalangeal joint, and your first MTP, metatarsophalangeal joint. We will talk about all the joints in detail in the upcoming videos. Also, arthritis can be divided as symmetric and asymmetric arthritis. So remember, your rheumatoid arthritis is a symmetric type of arthritis. Why? Because it's an autoimmune inflammatory arthritis. Autoimmune means having autoantibodies, which affect your both the wrist equally. Like God, autoantibodies also do not discriminate with your joints, whereas the osteoarthritis is an asymmetric type of arthritis. We can also categorize arthritis as an acute arthritis, that is days to 1 week, and chronic arthritis means 6 weeks or more. Remember, your rheumatoid arthritis is a chronic type of inflammatory arthritis. Means you need to be symptomatic at least for 6 weeks or more to diagnose with rheumatoid arthritis. Also, on the basis of joint involvement, arthritis can be further divided as arthritis which involve the small joints like rheumatoid arthritis and osteoarthritis, which involve the hip and knee. Big joints like polymyalgia rheumatica, which involve the shoulder, and arthritis which involve the axial joints and spine like your spondyloarthritis and your ankylosing spondylitis. Now let's talk about the rheumatoid arthritis and osteoarthritis. So rheumatoid arthritis is a type of symmetric and autoimmune inflammatory disease, right? So your patient will come to you with the cardinal signs of inflammation such as redness, swelling, pain, hotness, and disability, loss of function, which is worse in the morning and improve as day passes with physical activity. Also, patient will have elevated level of ESR and CRP. Whereas the osteoarthritis, which is an asymmetric and non-inflammatory arthritis, means your patient will not have cardinal signs of inflammation and elevated ESR and CRP. Also, the stiffness, unlike rheumatoid arthritis, is worse in the evening on place of morning. So lastly, this is the complete definition of rheumatoid arthritis. As we already discussed, that rheumatoid arthritis is an autoimmune, symmetric, chronic, systemic inflammatory disease which affects small joints with female predominance. Patients with rheumatoid arthritis might have both articular and extra-articular features. As we know that rheumatoid arthritis is an autoimmune systemic arthritis. Systemic means which can affect any part of your body. Thank you so much for watching. Please do subscribe the channel MMS Max Medicine Simple and help this beautiful lady with rheumatic disease. Her name is Simran. She is my imaginary patient. So help her to reach and teach more and more people like her about this necessary disease. So stay safe and study a lot. Thank you so much, guys.